Monsome News Agency informs.
On February 17, Prime Minister U.Khurelsukh visited some hospitals to examine their preparedness and readiness against the spread of the novel coronavirus. A total of 200 beds have been prepared at the National Center for Communicable Disease, 50 beds at the Central Military Hospital, and another 65 beds at the State Central First Hospital for the risky condition of the novel coronavirus infection. In urgent cases, it ensured preparation to fully isolate the Central Military Hospital and to transfer the infected patients to the hospital within half an hour. Preventing from the novel coronavirus spread, hospitals are operating 24 hours in a state of emergency. In connection with the outbreak originated in China, the World Health Organization evaluated risk in Mongolia 3 times. By the latest evaluation conducted on February 11th, Mongolia is included in the risky region where novel coronavirus infection can be transmitted and spread into the country. During his meeting with health professionals, Prime Minister U.Khurelsukh pledged to give overtime salary to physicians, nurses, hospital attendants, and staff who are working on alert, and said the funding will be resolved at the cabinet meeting to be held this Wednesday. Prime Minister U.Khurelsukh expressed his gratitude to the hospital professionals who are working 24 hours to prevent the coronavirus infection. He said, "Our citizens have to be responsible for their own health and safety of their children and elders, as well as for the national security and independence. This is a duty of every Mongolian. Everyone should wear a face mask and not celebrate Sasa. I hope that the infectious disease cannot be spread in our country if every single person, household and entity takes preventive measures together against the deadly disease and combat together. Therefore, I am calling for our citizens to be responsible and execute their duties." Authorities of the National Center for Communicable Disease put a request to provide new ambulance vehicles as the hospital lacks of ambulances for urgent calls of infectious diseases. Minister of Health Sarangirl made a decision on the spot to provide 3 UAZ vans to the center. Moreover, since the coronavirus infection leads to acute respiratory disease and kidney failure, it was decided to additionally order respiratory apparatus and dialysis machine with financing of 4.2 billion turuks from the Asian Development Bank and supply them to the National Center for Communicable Disease on February 25th. Diagnosis on suspected citizens with the novel coronavirus is being made in a laboratory of the National Center for Communicable Disease at the same level as infectious disease research laboratories in the United States and Japan.